you work at a very interesting kind of area in that you're in the intersection between physics, engineering, and medical, arguably biology as well. And you leverage a lot of artificial intelligence in some of your work, both your studies and also some of the development that you're doing as well. So maybe to start things off on a very broad scale, from your perspective, if AI is able to get to the place where you believe it can get to, what are some of the, changes to healthcare or the healthcare system that you think will come about from this? What are some of the kind of the big changes that are positive? And in the worst case scenario, if AI becomes something that's maybe an alternate universe, what are some of the biggest challenges in terms of what it could become that would be kind of more of a negative side of things? Maybe we'll start there.
Yeah, so let's start with the negative parts. um, so any type of AI model needs to be trained or based on real world data. And I think if our data is not representing the populations that we are serving, then then it will be dangerous. We have right now. I'm in the oncology domain, so whatever we develop is trying to solve unmet needs in oncology. And most of the models, for example, they are not trained on the pediatric population. We do have children who have cancer as well. The diversity in socioeconomic groups. So if we look inside Canada itself, um, male and female populations, and so on and so forth. So I think um, a danger is that the models are not general. They are trained on a subset of a population, and then we then try to solve a more general question or an unmet need. So we have to be careful in um, use of models which are developed on a very subset of population. So that is right now, right at this specific moment in time, one of my concerns. Yes. So, but also, if we generalize this, if we would have looking at it in a global perspective, for example, looking at developing countries, um, again, we develop if we develop models incorporated in medical systems that we then um, export or sell to the developing countries that are not trained and based on that population, that's also a very big danger. Uh, so again, it's many people talk about garbage in, garbage out. So here our data is very, very important. Actually, the data is as important as the people sometimes concentrate a lot on the models themselves or the AI part of um, the equation, but the data is very important. So we need to always be mindful of which populations we are serving, and whatever um, uh, unmet need that we've tried to solve, either a software that we've developed for clinical application, or software that supports a hardware component that again answers for an unmet need. It must be generalizable based on all the members of a population that we are trying to um, serve. And the positive ones is that in Canadian healthcare system right now we have shortage of staff. We have long waiting times. We have people who are waiting for their treatments. So AI hopefully can automate um, and help healthcare to um, to to both, so that there are AI can be used in so many steps in a healthcare system, and it can help to um, answer some of the needs when it comes to personnel shortage. It can also remove some of the inter and intra observer variability amongst the clinicians. It can help, yeah, to both diagnose and more accurate treatments. Um, so it can both um, help to increase um, the outcome, the quality of the treatment, and then decrease the shortage of personnel, cutting the waiting times a little bit. However, all of that again is based on the data that we have